Dr. Zaibak, when you talked about TMJ disorders, basically meaning the joints here are misaligned and the whole mouth is misaligned, and then that may come because a person had maybe a car accident, got a whiplash or whatever, maybe all kinds of reasons, missing teeth as you mentioned, or just teeth grown badly from the beginning as a childhood, whatever. All kinds of reasons why that could happen. And when you adjust this DMJ, that could be with a mouth guard, which makes things right. There's all kinds of ways to do that. But you have told me that quite often the muscle tension up in the head, down into the back body, back pain and neck, shoulder pain, quite often also requires a chiropractor. And you even said that then chiropractors sometimes make the diagnosis that even a podiatrist needs to come into the game, and in order to cure the guy's headache. Yes, you may cure the TMJ yourself, but things are already so out wacko that if the guy doesn't get a chiropractic adjustment and or even a foot adjustment, be it orthotics or whatever it might be, that it all might go out wacko again. Tell us about that. I mean, this looks like an awful lot of influence from just that little tiny thing here. Do you understand?
Yes, surprisingly, everything, those fields, chiropractic, podiatry, dentistry, physical, everything is linked together. And the TMJ, believe it or not, there have been cases where I tried to treat it as a dentist with appliances, and yes, we made the patient more comfortable, but the symptoms still persisted. So, luckily, I had a chiropractor friend that I was just casually talking to, and to my surprise, they also treated TMJ as well. So, we kind of collaborated together, and we learned from each other, and we referred to each other for the benefit of the patient. And I realized that there's also, in conjunction with their treatment and my treatment, we can definitely eliminate TMJ problems, where they basically strip the muscle and the joint in the TMJ area, and they try to relax it through their chiropractic education, and it helps significantly. And even from them, I learned that they also refer out for TMJ issues, because if the spine is not correctly, sometimes it can cause TMJ problems, and sometimes when the spine is not aligned correctly, it is sometimes due to a pediatric issue, and they were then in turn refer to the pediatric doctor.
So basically,
podiatric.
A person could possibly be having headache because his jaw is out of alignment, and so he burns the candle on one end, and his feet may also not be out of alignment, or maybe because the jaw is out of alignment, the feet get out of alignment, or vice versa. It wouldn't really matter which way it comes about it, but for all purpose, he burns the candle at both ends.
Yeah, it's usually basically, as funny as this sound is, if your feet are not correct and you're not walking correctly, you're gonna basically your spine is not correct, and then if your spine is not correct, then your jaw is probably not going to be correct. So it kind of travels.
Is it true that the jaw, the DMJ, don't ever make me pronouncing the full word of it. You're free to do so, but don't make me doing it. Is it true that particular hinge, that particular joint is one of the, if not the most complicated joint in the whole body?
Absolutely. I mean, I'm going to be biased against this because I'm a dentist, so I'm going to always believe that the oral cavity is a magnificent instrument, and it's called temporomandibular joint, and it is the basis of our survival. I mean, we chew with our, with our jaw.
Right.
And we talk and we speak and we communicate, right. So it is very important.
And I heard that jaw it moves this way, it moves this way, so it basically moves in all four dimensions, if there's such a thing, which most other joints don't do so. They kind of have a much more fixed blade of laying on it. So this jaw can be displaced much easier than other joints.
Absolutely, because there's more muscle attached to it and more ligaments, and we're able to kind of, manipulate it in much more than other joints.
Okay. All right. Well, wonderful. So basically, the body works together. There's this, everything works together, and dentists like you recognize the need for involving other professions, because in the end, what the guy wants, he probably doesn't even care about his jaw being aligned. I don't think he feels it necessarily that way, but he wants to get rid of headaches, shoulder pain, back pain, and stuff like that. And then whatever it takes to achieve that, one might have cost the other one. Something out of alignment in the back might have pushed the muscles out in the jaw. Some jaw might have pushed it out down the way. But either way, sometimes you know that all three are needed. And if one treatment doesn't do it, or if it was there for a long time and you know that the muscles are going to be tense still, then you know to bring in other people. That's basically
it basically comes down to, we are doctors, and we need to basically look for the best interests of our patients, and we need to involve multiple disciplinary sciences in order for us to basically treat the body, the mouth, the whole, because you can have headaches from other parts of the body that's causing it. You can have jaw aches from, and I learned this as I was, from working with other professionals, that how everything is kind of linked together. And that's what gives us more respect for other disciplinaries, to work with them to kind of solve our patients' issues. And that's, I believe in my heart, that's what we should treat. When we treat our patients, we should look at it as, what is the root cause of this? Maybe there is something other that's causing this. Maybe I should go ahead and talk to my local chiropractor or local professionals to see what is, all this, this is the body. It's a human body. The jaw, the mouth, everything is linked together. It should all, and therefore you should work with multiple disciplines. This is a multidisciplinary body, therefore you should treat it that likewise.
Right. Well, like in another video where you mentioned that surgeons, be it for appendix, be it for a hip operation, or be it for a whatever surgery has to be scheduled, except emergency type of surgery because you had a car accident. But those type of normal planned surgeries, surgeons more and more over the last year or two or three start demanding a clean bill of health from the dentist, because they know that a gum disease is endangering their other surgery because the body is weak. And so it starts looking like even the medical field obviously starts realizing, because they haven't done that all the time, that the body is affecting their surgery. So all of you guys start realizing, you need to come together. Not that you haven't been, but advancements are made continuously here, it looks like. Thank you very much, Doctor. Go ahead.
And this was one of the main reasons why I basically devoted, my book, The Hidden Truth Behind Beautiful Smiles, to this, because to show how all the disciplines are linked together for the benefit of the patient.
So that sounds like an interesting book. So it's not what you're telling me. Your book is not only about what is a veneer and what is a crown and all that type of stuff, and how to brush, even though I'm sure that type of stuff is in it, but it's also about how those other medical disciplines work together in the body.
Absolutely.
Great. I think people should read it. Bye-bye, Dr. Zaibak.
Thank you.